I am excited to be joined today by Roseline, who will share her personal experience with preprints and their impact in the Global South. Welcome, Roseline. Could you start by telling us a bit about yourself and your research background?
Hi, Fatima. Thank you so much for inviting me to join you today. My name is Roseline Dine, and I am a social scientist, public health specialist, and a health research methodologist. I am also the Review and Curate Network founder, which was being supported by the Asabao Seed Grant earlier in 2024. It was from there that we started the initiative of promoting open science in general and preprints in a broader landscape in Rwanda and later expanded to other parts of Africa.
It's really nice to meet you. So how often do you post or use preprints?
Oh, very often. I use preprints very often, and I work with preprint repositories and such as the Afri Archive, even archive different types of repositories simply to retrieve or to look for preprints that can be reviewed within the network. As I told you before, I run the Review and Curate network, and each quarter, or which is made out of 3 months, we aim to review approximately or a minimum of 10 preprints. So that is just to give you a little bit of knowledge on how much or how often I can interact with preprints within a given time frame. So it's either I am supporting people to review a preprint, or I am looking for preprints for people to review, or I am joining other networks or organizations such as the prereview.org to organize live sessions for other groups of different individuals, or for those that have just simply requested that their preprints should be reviewed, or I am teaching or hosting a webinar with different partners on how to review preprints or even reviewing preprints. So I would say often, very much, like in a month I can have more than 2 interactions with preprints.
So what kind of response do you get?
In terms of posting preprints, of course, different people have different ideas on how, on in regards to posting preprints. Personally, I have posted preprints, but it depends on individuals why they will want to post their preprint. Of course, some people welcome the idea, and some people do not really welcome the idea. However, I strongly believe that posting preprint has its own benefits that we should try to encourage, especially for new researchers, because they can benefit a lot out of it. And I keep advocating that young researchers should buy this idea for their own good first, so that they can see how influential it is. It plays a greater role in their career path, and before looking at the communal benefits. That notwithstanding, some people fear that their preprints will be scoped. Last year, I attended the open access conference in South Africa, and I was being questioned by so many people who reached out to me asking, okay, you are promoting the use of preprint. You know, preprints are not the final version of our work. They have not been reviewed. So what if the science we are putting out there, it's being mistakenly used as people for the final version, and it causes problems in the scientific community. So it's not only about sharing our science findings faster. There's so many people do not even understand how preprints work. So if people do not even understand how preprints work, the scientific community, they don't even know the difference between those that have been reviewed or those that have been accepted and things like that, then becomes a challenge. So all in all, we have advantages and we have disadvantages, and I think we still need to do a lot of talk on what really are preprints and how to use preprints. there's still a lot of work to do. So many people do not understand, including very experienced researchers or publishers.
Talking about submitting to a journal, how was that process with the preprint?
For now, at this stage in my career, if I decide to preprint an article, I just preprint. But sometimes you get, if sometimes you just get rejections. For example, I just remember there was this article I tried to publish very, it was like a continental article. And the mistake we did is that we did not collect informed consent forms. People did not sign informed consent. No, people did actually, but we did not request for ethical approval. So publishing the article was a problem. And so we ended up just preprinting it. That's number one. However, often I just preprint articles like that, or maybe during a submission stage, I am asked if I want to preprint. But more often, I don't accept preprinting during submission. I decided from the beginning if I want to preprint my article or I don't want to preprint my article. So this is a service that I haven't used very well, aside from the beginning, and I take the path that I want to do.
What led you to preprints? Like how did you first come across preprinting?
That's when I was serving as e-life champion. That was way back in 2021 when I served as an e-life champion. And then I got to know about preprints. So I was introduced to preprint when I started serving as an e-life champion.
That's very great. How do you use preprints in your work?
I use preprints often to demonstrate that this is also another way of communicating science through advocacy. Often I do a lot of advocacy when it comes to preprints. So, and sometimes I also cite them when there is limited literature or information in an area that I am working on, and preprint is the only output that I have. Or preprint, if I happen to see a good preprint, I will use it for my work. So if the preprint, one of the criteria I look at is has a preprint receive public appreciation. When I mean public appreciation, I mean, for example, open peer review. If it has received open peer review, and also what is the extent to which the scientific content presented in the preprint might be correct. So I also try to judge for myself. So I use it in applying for grants as a source of information, writing my proposals, and also my write-ups, often at the early writing stages. Yeah, so but it definitely depends on the content. But I'm not sure that I do use preprint a lot as compared to how much I advocate for the adoption of open science, which is part of preprint use and interaction.
Okay. So what are your perceptions of preprints and why do you use them?
Personally, I worry, especially for my people in the global south, because I fear that people are not able to judge when it is right to use all this sort of preprints, or people are not able to write well, to be able to write preprints that are convincing. And we still have a very low pool of reviewers or people who are willing to sacrifice time to review preprints. And so you will find that researchers or very young researchers who are just trying to start up with their lives, they put out their scientific evidence, making it difficult for people to use because they feel that it still needs to be polished. And so using it becomes a problem. What I think is that we should, preprints still need, especially in this part of the world, they still need a lot of work to make sure that people can use them in their form. If we can get people reviewing these preprints, like helping us to review them so that it can also be the journal articles, then that'll be fine. But I think another thing we need to do is if I see a preprint that has been reviewed, for example, in Society, I am happy to use it. Very, very happy. But a preprint that is still very bare, I am very skeptical about it. Then I need to spend a lot of time reviewing to also judge the literature. I'm speaking from the viewpoint of a reviewer, a user, and an advocate, there is still a lot of work to do. So I am afraid the response to this question to me is that there is still a lot of work. Preprinting is good, but at its current stage, there is still a lot of work because when I see some content, I fear that actually people might just forget the scientific structure on doing work. But there are some
Yeah.
of them that are really good, well written. And maybe my challenge is that maybe preprinting is not emphasizing on scientific. Most preprint repositories are not very strict on scientific writing or scientific style scrutiny. For example, if you write a systematic review, you have a framework that you have to use. If we can be strict on at least some of those things, maybe they will improve the output of some of our preprints. Preprinting is good. Preprinting an article is good, but if you look at, if you kind of survey and see how many people, how people write it, some of them, I don't really know. So I am still 50-50, and I think there's still a lot of work to be done. Yeah.
Yeah, that's correct. I really agree with you. Do you have any concerns using preprints?
I think I have said it all already. We really need to work. We really need to work. And my look on this is if we want to move from the stage where we are, we need to start working with the very young ones and the faculties. And I don't know how long this is going to take. UNICEF has been advocating for this for a long time, even providing recommendations on open science since 2019. I don't know how we are going to do this, but in my own path, I'm trying what I can, but there is still a lot of work. There is, we are not yet at that very proactive stage. So that's what I will say.
Do you experience any barriers to using preprints?
Yeah, of course. They're not yet, for example, if your supervisor or your teachers are not welcoming the idea of using preprint in your scientific write-up, so it becomes a problem. Your supervisor doesn't agree with you, your teacher doesn't agree with you. There are some schools that will say, "Oh yeah, we accept," but the practical sense, how many of them are actually using it? We have policies, but in practice, how many are really working? So, of course, there are challenges at the individual level and institutional level.
Okay. Would you recommend preprints to others?
Yes, I have. I will do that, and I have been doing that. As I said earlier, there is still a lot of work to be done for us to reach that stage that we want to. Very important.
Okay. Roslyn, before we close, do you have any final thoughts or messages you would like to share?
I really think we need to work as a community, and I really think I'm looking forward to the findings in the first place and what the aims are overall, and taking the findings from this to action because we do so many things, and I'm worried that most of what we do are not being affected in communities as well, and it becomes a problem. So please, from the findings, let us try to strategize and see how we can make a better benefit from this in our community if we really want to take this open science thing forward. I understand some of the challenges that also exist in implementing all this, but we really need to do something. I don't know how for now, but I strongly believe we need to do something in order to move because I feel like we are still in the same position. Like even if we've changed, it's just a little bit of change. For example, funders simply say they will all their fundings funded projects. I think the Bill and the Gates, I don't know if the Bill and the Gates Foundation recently joined. All their funded projects have to be pre-printed and things like that. But I don't know. Maybe in other parts of the world it's working very well, but I'm speaking from Africa for Africa. I think we are still very far. Let me tell you what I realized in my few years of operating or working with preprints. So
Yes,
many
please.
people say they are interested in open science and they are working on open science. But when you go now to the core or the principles of open science, people are not really doing what we are thinking that we should do or they are doing. I know that when we talk about open access, we mean so many things. And when we talk about open science, also so many things. But I mean, how many people in Africa can pay? Let me not go to how many people. I'm seeing it as we still have a lot of work in terms of its uptake, because if you look at the African population and how many people are actually uptaking the preprint and even understanding what it's all about, because some people just preprint at the stage of submission, but do they really know what it is? They just preprint like that. And then maybe when you ask them to use it, they don't want to use it. So maybe there needs to be another model, or there should be a restructuring on how this should work.
Yeah, absolutely. Yeah. Thank you so much, Roseline, for sharing your experience today. It was great hearing your insights on preprints in the Global South, especially in Africa.
Thank you.